filling the healthcare gaps in Columbia, a local chapter of Alpha Kappa Alpha Sorority Incorporated hosted a community day to provide health screenings to help address high blood pressure and diabetes issues in the city. News 19's Zoe Henry spoke with the organization about the greater impact.
For the first time since the pandemic, the Gamma Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated presented its Community Day. The event usually entails live entertainment, scholarship awards for high school seniors, local vendors, and more. Diane Price-Williams is the chapter president.
Exactly. With our organization, we have 6 major initiatives that we're working on, and that includes sisterhood, empowering our community, empowering our environment, uplifting our community, advocating for social justice, building economic wealth. We're doing those things because we want to make certain that our community is healthy.
By adhering to those goals, another focus was bridging the gap in healthcare in the 29203 area of Columbia with health screenings.
What is it?
Avis Buchanan is the director of nursing for the South Carolina Department of Mental Health.
People are having high blood pressure, and so a lot of them are coming and saying, I didn't take my blood pressure medicine, or I'm half taking it. So we're focusing on the things that we feel are important.
She adds, in this particular area, this isn't uncommon.
We know that just because of the population, we're having a lot of issues with obesity, high blood pressure. So we focus a lot on those kind of things.
Tony Wilson is a clinical instructor at Midlands Tech. She says in order to help lower numbers in this area, there needs to be resources other than medication to help with the prevention for these illnesses.
And so we are hoping that by instructing you different clients about the diet, not eating a lot of fast foods or salty foods, eat more baked foods, turkey, fish, those type things to help them with their diet.
Event organizers add, it's important to bridge the gap to build a healthier community in areas often overlooked. In Columbia, Zoe Henry, News 19, WLTX.
And taking a closer look at the numbers here in South Carolina, DHEC says about 1 in 3 South Carolinians have been told by a doctor that they have high blood pressure, which is also known as hypertension. Diabetes Free SC estimates that over 500,000 have actually been diagnosed with diabetes, and almost 1.5 million have prediabetes. That means almost half the state's population is affected. And because there are usually no symptoms, high blood pressure is often called the silent killer. The best way to find out if you have high blood pressure is to check it regularly. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral drugs may be part of your treatment. And for those that don't yet have diabetes, there are things you can do to lower your blood pressure. You'll want to eat less than 1,500 milligrams of sodium a day, aim for a healthy weight, get at least 30 minutes of exercise most days of the week, take any medicine you're prescribed, and do not smoke.